I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're joined in the studio by Politico New York healthcare reporter at the Capitol, Katelyn Cordero, to discuss some of the state's spending on healthcare approved this spring in the state budget, as well as what didn't make it into the final deal. Thanks for making the time, Katelyn.
Thank you for having me.
Well, healthcare spending is always a driving force in the state budget, with this year's spending plan including, as you reported, more than $1.5 billion in new dollars for healthcare providers, with your reporting spelling out that hospitals would see a $706 million increase, $480 million for nursing homes, $80 million for federally qualified health centers, and $20 million for assisted living programs, which comes at a time when a lot of these stakeholders are bracing for or already realizing a loss of federal dollars. So how do these figures, which on their face seem like a lot of money, compare to what providers were hoping to get out of Albany?
They were happy to see all of these inclusions in the budget. However, some of them were looking to see more. Qualified health centers, community health centers, they were asking for $300 million, and they only got 80. And the reason why they're asking for that is because they're expecting an increase in uncompensated care, with more people being uninsured due to H.R. 1 and policy changes with eligibility for some of the low-cost public health insurance plans. You know, others, for example, Planned Parenthood, asked for additional funding that they didn't receive. Their funding remained flat. But again, $1.5 billion is a very large increase for funding for healthcare providers.
But do you have a sense, though, how this money, like in the case of those federally qualified health centers, will actually help bridge a gap? Because if we're talking just a fraction of that money, it almost sounds like here's a Band-Aid for a bullet wound. It's kind of thanks for the Band-Aid, but it might be pointless.
Yeah, and that's what I've been hearing from a lot of those providers of we are facing, this kind of kicks the can down the road a little bit, but next year we really need the state to step up and to find meaningful ways to help us address these cuts. So they're looking at, this year it may get them by, but then next year we might be in crisis with some of these providers.
Well, you mentioned the idea of these providers turning to the state for help, and then I have the voice of Assembly Speaker Carl Hastie in my mind reminding people, well, we're only in this situation because of federal changes. I mean, is there any indication that these providers are hopeful that federal policymakers will reverse course on some of the fallout from H.R. 1?
Yeah, I think a lot of them, especially hospitals, have been lobbying the federal administration and lawmakers at the federal level. And, they have been pushing for that as well. And we've seen multiple examples where New York has benefited from that advocacy. So we've seen, an extension of the MCO tax. We also saw New York received $212 million from the Rural Health Transformation Program. So there have been examples where the federal government has been more, has given New York more. And, it seems that some of that has been the result of advocacy. And, I know Congressman Lawler has talked about how he has been advocating as well for New York to receive additional funding, for New York to receive the MCO tax extension. So we've seen kind of how that has played out and how the federal government has stepped in a bit. But I think they're really focused on, for the state budget, really focused on New York kind of filling in where the federal government is stepping back.
Yeah, and I want to stick with that theme, but just for listeners who aren't familiar with some of the alphabet soup there, MCO tax, basically the shorthand is it's a tax on managed care organizations. It was a way to get a couple $2 billion out of the federal government. Now we're going to have a scaled back version of that moving forward if federal officials approve it. But sticking with the fallout from H.R. 1, you've been following the issue of health insurance coverage for more than 400,000 New Yorkers who earn too much to qualify for Medicaid but have been able to get low-cost health insurance, or in some cases no-cost health insurance, through what's known as the Essential Plan here in New York. They're getting kicked off that state coverage this summer. Anything in the budget to cover these people or maybe smooth out that transition to other plans?
No, that group is going to be left searching for coverage, or they're going to be uninsured. It's unfortunate because a lot of those individuals make, before they left, before They joined the Essential Plan, and New York created that expansion for 200 to 250% of the federal poverty level. Those individuals were receiving federal subsidies if they were on the Obamacare marketplace. So they were able to have federal assistance with getting their insurance coverage. So now that those subsidies don't exist, they don't have the assistance from the federal government. They don't have access to the Essential Plan. And these are individuals that make around $30,000 to $38,000 a year. So they don't have a ton of room in their salary to be able to pay high premiums or pay an exorbitant amount for their healthcare coverage.
And do we have a sense of what's going to happen? I mean, there have been predictions that range from, okay, maybe a few 100,000 of these people are going to find alternatives. Maybe it's their employer. Maybe they'll be able to pony up in the marketplace. And then we've also seen more dire predictions, it seems like, about the vast majority of these people struggling to find coverage and subsequently being a drain on the healthcare system. Do we have a good sense of what could happen, or is it sort of an unknown at this point?
What I've been hearing is that it might be more on the more dire situation because the individuals who did get their coverage through their employer previously, they only qualified for the Essential Plan if it was, I believe it's more than 8% of their entire salary would have to go to healthcare coverage. So when they're making that amount, 8% is a significant amount for them, so they may not be able to afford their employer-sponsored coverage. And we asked Speaker Hasty about this just this week, and he said that they don't have a plan for those individuals. They increased funding for hospitals and for healthcare institutions, that $1.5 billion. And, it seems like the thought process there is this will help to cover the uncompensated care that they're going to have to be putting out for uninsured individuals coming in through their doors.
One of the controversial issues that the governor was pushing, and I know it's controversial because as soon as we heard from one side of the issue, the other side wanted to come on the show. That has to do with the state's independent dispute resolution process for out-of-network payments. Can you explain, I guess for starters, from your perspective, what was the problem that the governor was looking to address? And surprisingly, what was she able to actually secure in a final deal with the legislature?
So we had a process that health plans felt was not fair towards them. It's a baseball-style arbitration process where the two parties, the health plans and the providers, will put out their proposal, and the arbitrator will pick one or the other based on, a list of considerations that they have over which one to choose as fair.
And these are for those out-of-network cases where they haven't already figured out this is how much you're going to pay. And all of this stems from some surprise billing reforms that were adopted like a decade ago.
Exactly. And so you had a rapid increase in the number of cases over the last couple of years. And providers will say that there's more knowledge of the process within providers, and that this is the result of low payments coming in from health plans for out-of-network care. And then health plans will say that this is abuses of the system and providers taking advantage of the system. So the governor proposed to take Medicaid out of the IDR process, and she successfully did that, and that'll save the state. They're projecting $28 million. And then on top of that, for the state employer health plans, they created a new benchmark for arbitration, for the arbitration system. So it's a lower benchmark of the proposals that they're allowed to consider when they're looking at, who they should choose.
Another topic you've followed more broadly, and I'm curious whether it got any play in the state budget, is the effort to respond to the opioid epidemic in New York. And while we have a settlement fund advisory board designed to help steer some of the billions of dollars that we've appropriated through settlements by the Attorney General, there's been disputes over where money should go, where some of the banked interest needs to go. Any action in the state budget on this issue?
There was, outside of using settlement dollars, and then they also made sure that the $34 million that the state collected in interest was also going towards opioid and substance use disorder treatment. So outside of those investments, OASIS, the Office of Addiction Services and Supports.
Nailed it.
Okay. Lots of acronyms. So Oasis did not get an increase in their funding. Advocates and providers are saying that the state needed to step up and add additional funding, and they're concerned that the settlement funds are being used to supplant the state's obligation to increase funding for these agencies and for these programs and services.
And that's a problem because in state law, the money's only supposed to be used to augment existing initiatives?
Yes, you're not allowed to use settlement funds to supplant, it's supposed to be kind of in addition to what the state is already doing. So it's supposed to be used for, additional programming and resources and things like that, but they're not supposed to be using those funds for state programs and things like that. Was
there any fervor or effort to change the fact that under the current dynamic, the state is able to build up, $34 million in interest, which is only possible if they've got money sitting in a bank account and not being spent?
Yes, that definitely is part of the conversation. I think, there was also concern that funding was being put into the general fund previously and not put into the settlement fund, which has this budget fixed that situation. But yes, there is lots of criticism that the funding is not being pushed out the door quick enough, that there's not enough transparency surrounding how the dollars are used, especially because a portion of the funding is just given to counties, and counties up until recently have not been required to report how they're using it. So there's a lot that's a whole can of worms to unpack is, the opioid settlement fund, how those dollars are used, and kind of the discourse between the advisory board and their recommendations and how the state actually pushes out the money and allocates it.
Well, we've been speaking with Katelyn Cordero. She's a healthcare reporter at the Capitol for Politico New York. Katelyn, thanks for visiting us.
Thanks for having me.
Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.